Up and ready to go. The good mayor of the city of Vicksburg, Mississippi.
Absolutely. How you doing, Paul?
I'm okay going through this head cold here, but other than that, you free of COVID and everything okay?
So far, so good.
How's the city of Vicksburg doing?
Great. It's never been any better.
So what's the mask regimen now for the people in Vicksburg?
We're down to the last two measures, and that is you must wear a mask anywhere that you cannot practice social distance, whether it's in a restaurant, whether it's in an organization meeting, or whether it's in church. We probably done got near at least 90% of open. The only other thing we have to do is to open up our bars another 2 hours. Right now, they can serve up to 12 o'clock, but they must be closed by 1. I'm looking at allowing them to serve up to 1 for a month and close by 2. And the other thing is that we have what we call a crime prevention team out there on Thursday, Friday, and Saturday night, where my deputy chief work along with the shift commander.
Are you a little bit surprised that some of these other states are seeing a rapid increase? And I don't understand why. I do understand the spring break, but some of them, it's not happening here or in southern, I don't think it's happening in Florida or a couple of other states in the South. But in some states, and I have a number here of somewhere I was looking for, but are you a little bit surprised that some states are increasing?
Well, absolutely not. I believe that Mississippi and certainly Vicksburg has implemented the necessary civil emergency orders as we have been able to analyze the data. I commend the governor and Dr. Tobbs and all the people of this state that have responded to the civil emergency around this state. I know there's been some pushback about the mask mandate and about the governor releasing, but we was given a responsibility at the local level to implement. And in fact, if you recall, I was one of the first cities to implement a civil emergency order, which came up with mandates and restrictions. Hired a compliance officer. She did a great job in monitoring. We notified by educating the public on what we was doing and why. I hadn't had no pushback from the community. Now I have a few people are still hitting at me about the mask, but I think the mask will be here in Vicksburg as a mandate if you can't practice social distance for at least another month. And then once that gets here, our city will be completely open. Paul, it's unbelievable of the number of people that are now downtown Vicksburg from Thursday to last night on the streets of Vicksburg. I am amazingly happy with where we are in Vicksburg.
I think everybody wants to get out, and you can see that, and they want to do it. And I agree with you. I think the mask is going to be there's going to be a reasonable number of percentage of people who continue to wear the mask and feel safe and feel comfortable doing it. And also, we're going to have to get to a point where if somebody's not wearing it, they can't be aggravated about that. And I think we've reached that point.
Paul, let's just use common sense. If the mask mandate were not working, we would be reducing the number of cases. I believe we're mitigating the spread of this disease. I think we're reducing the death, and I think the numbers are there to prove that mask mandates or mask wearing and practicing social distance is working, and along with sanitizing.
Well,
if it ain't broke, don't fix it.
My friend, you've been in politics long enough. I'm surprised you can't please 100% of the people. I can't believe that there's anybody who's aggravated against you as far as the mask is concerned.
Well, I don't feel bad because I'm at 99.9.
Well, if you work hard, you can achieve a little bit better. Now, here's the story I was talking about, Mayor. Officials say there's just a handful of states responsible for nearly half of America's new virus cases. That's according to the data from Johns Hopkins pointing to Florida. I didn't realize it was Florida. Florida, well, everybody at the beach, of course. Florida, Michigan, New Jersey, New York, and Pennsylvania. You put those 5 states together, Florida, Michigan, New Jersey, New York, and Pennsylvania, And those numbers show those states account for nearly 198,000 new infections over the past several days. They make up 44% of the entire nation as far as new cases are concerned. So
I'm not surprised.
We're doing good.
I'm not surprised. Those are the states that from the beginning was having problem with any type of order or civil emergency order and getting people to participate. But I think when you look at the states that are left, I think we've done what the presidents have asked us to do, what the CDC have asked us to do, what the president task force have asked to do, and what the governor and the local healthcare officer has told us to do. And I'm just telling you, Dr. Dobb is doing and has done a phenomenal job with this. He stayed on top of it.
I agree with you.
I like about him, he stayed accessible.
Everybody who's had to make tough decisions on this one, none of them were easy. None of them were a situation where you could go back 5 years ago and see what we did in the pandemic then. And so it was breaking new ground.
But they was necessary, Paul.
Yeah, I agree with you.
Nothing comes easy. If it's easy, it's probably not going to last.
Let me switch. Let's switch to the infrastructure because I don't have a lot of time with you, and I want to ask you about this. More than half of Biden's infrastructure bill doesn't go to infrastructure. It goes for a lot of different things. We see this not only with the Democrats, but with the Republicans, but mostly with the Democrats over the years, that if I'm going to put some charges on the taxpayer's credit card, do it for what I need. Don't put a lot of other stuff on there. And that's what they've done. And now we have a situation where apparently the president and his people want to change the meaning of infrastructure. I hope you can hear this.
I'm prepared to work. I really am.
Wait a minute. Tell me if you can hear this.
I'm prepared to work. I really am. But to automatically say that the only thing that's infrastructure is a highway, a bridge, or whatever, that's just not rational. It really isn't.
So now we got a situation where anything that they want to call infrastructure can be infrastructure.
Right. Paul, let me say this. You know, I've been in the legislature. I was in the legislature about 26 years. Now I am an administrator for a city. I know when you're dealing with a process, you try to put out in that process for the beginning everything and anything you can, and then you start negotiating as you get through the process. I am not surprised at the beginning of this infrastructure language. I do know this, is that the United States need an infrastructure bill where the money can go into highways and bridges and streets and local level for piping. I just talked to the national NBCS news reporter the other day, and I told her that everybody still have lead in their pipes. How do you get it up? No, you can't dig them all up, but we got to put in place enough money so as we dig up, or if we find leaks, we can replace them with the quality of pipes that we need. But you just can't go. No city in this country would have enough money to redo this infrastructure. It's just not going to happen. Congress can't put enough money fast enough. But what we can do is put flexible money in the hands of municipalities, and I mean from the White House to the outhouse. The money got to come down to where the potholes. The potholes is where municipal government begins.
But I can understand that. I can understand underground water lines are infrastructure. But when you start looking at people like Senator Kirsten Gillibrand of New York, she says paid leave is infrastructure. Child care is infrastructure. Caregiving is infrastructure. Don't you think that's taking it a little too far?
Well, I'm just saying that all those things that you named are necessary, but they ought to be a priority of the infrastructure.
The good mayor of Vicksburg, I got a story here. MSNBC apologized last week for mistakenly airing video of black congressman while reporting a day earlier in the death of U.S. Representative Al C. Hastings of Florida. Did you see this, Will?
No, I didn't see it, but I read about it, and that's unfortunate.
It was.
But, you know, I knew Congressman, and before then he was a federal judge from Florida, L.C. Hastings. And in fact, I was in his company many times in Florida. and my respect goes to his family and everything. But those things happen. I've been mistaken a couple times for Bill Clinton and for Donald Trump and for President Bush and other folks. So, people sometimes take pictures and put them
Yeah.
out of order.
Well, I understand, but that was a reasonable era. This one wasn't. So we'll just leave it at that. But again,
Yes, well, that could happen because I'm told if I shave my hair, I look like Jay Z. So that could happen.
I've often thought that. Yeah.
I remember being in Florida. And a lady walked up to me and told me that I know you, and I said, "You do?" And she said, "You Jay-Z." And I said, "I wish."
Well, you could have said you were Jay-Z's father. That might have worked out.
I would have said I was Jay-Z's. But I probably should have said I was Beyonce's husband.
Let me ask you this. If you got some money coming in from the infrastructure, where would you use it as far as Vicksburg's concerned?
In infrastructure and in tourism. Yeah. We've been told by Congressman Thompson that although the money is coming in here, it's been put in the proper places according to Delbert Holtzman and our senators in the legislature. It's been certified. What we have to do now is wait on the regulation. And when the regulation comes, we're going to look at the best way to spend it, the most creative way to spend it. I think it's going to significantly help our infrastructure. One, because it's one-time money. I am not going to put the money or recommend that the money put in anything other than one-time problem budget. Because the worst thing you can do is get a big sum of money and put it in reoccurring expenditures and expect your growth and your revenue, your budgetary process to not grow. So one of the things we're going to do, one off the bat, is that the money must be spent in one-time project, and they must be shovel-ready.
Yeah, we know how shovel-ready projects worked out the last time, but I'm a little confused because my understanding is you could actually take some of this money and put it in the bank, draw interest on it, and you don't have to spend it all at once, right?
Well, that's not my understanding. If it's so, I don't believe in that because if that's the case, why give us the money?
Wait a minute, wait. Are we talking about money that is coming in now or money from the expected proposed but not yet passed infrastructure bill?
No. We're talking about the money I'm talking about the $4.88 million that I'm supposed to get as it relates to the last bill. Now, on the infrastructure bill, I can see where you may be able to put it in the bank because let me just tell you something. When you're dealing with infrastructure, you deal with construction costs. You have to bid, and you have to do any number of things in a governmental process. So you may not be able to spend the money or start a project as soon as you elect to. So why not let the money be drawing interest, and then when you do get ready for the process or start the process, you can use that money to cover the cost of the project.
Always good having you on because I can.
Well, MDOT always had money they can put in interest-bearing account.
Well, that's another subject on its own and all the things that are going on there. But I do want to ask you this as far as the initiative process, and pick your brain on this one as a lawmaker and now mayor. But when you look at the initiative process, and from what we see, we could have an initiative for the Wildlife Fund. We could have an initiative for Medicaid, and there could be some type of educational initiative on the books or on the ballots in the next one. What's your thought about this, Mayor?
Well, it's unfortunate, but you know that I was one of the few legislators that vote against the initial process because I think it's bad when you start electing people to position and then circumvent them. All you're doing is creating confusion. Now, having said that, I just think it is incumbent upon the legislative process, the governor, lieutenant governor, and the speaker, to try to work some of these issues out before it get into where they want to legislate them by around the legislative body. Because when that happens, all you're doing is creating a confused process. I would hope that Medicaid, I would hope all those projects can come through the press. And when I was there, I told them, I believe if I had been in the legislature, I could recommend to a Republican supermajority, House and Senate and Governor, a Medicaid proposal, a proposal that would expand Medicaid without inflating the budget. And I think that's what they're afraid of, inflating the budget. Florida did it. Florida did it in a way, and I think we can do it in a way. And what you do, you have two kinds. You have a Part A and a Part B Medicaid program. Part A will be the standard you got now. Part B will be the new, so that you can have some accountability and you can have a Medicaid program that reaches and provide affordable health care for people that needs it without disturbing your state traditional health care system.
I think it makes a lot of sense, and I've asked that before. And you
always make a lot of sense, Paul.
Well,
I always make a lot of sense when people listen to me.
I'm under medication, so I'm not going to argue with you. Part B, as you mentioned, couldn't you just say, look, we'll pass this, we'll get it done, we don't need an initiative, we'll do it, and for some reason, if it becomes unaffordable, if the federal government stops their portion to the point where we can't afford it, then Part B will drop, and boom, that's it.
I said that many times when I was in the legislature my last couple of years.
Well, how come people are not listening to you?
Well,
how come
because I'm not in the legislature. Because I'm not in the legislature.
I'm talking about back when you were in there. Well, that's okay.
Because they wouldn't listen. But you could have a Part A and a Part B, which hold Part A accountable for Part B and Part B accountable for Part A, and you can have a distinguished identity between the two of them, and then you can expand the services to all those people. You don't have to put, just because you call it Medicaid, it doesn't have to be in all the Medicaid tech programs. You could have a program, a standalone. And then you got the insurance part of it with Mr. Cheney that it takes some time to explain because it's kind of complicated. But there's ways to expand Medicaid, one. There's ways to spend the Medicaid dollars, and there's ways to spend it without inflating your budget. If you create the right structure.
If it is on the ballot, will it pass?
It will pass. It'll be just like marijuana. In fact, going forward, if the legislature don't start addressing some of these issues and stop circumventing them, a lot of issues is going to go straight to the ballot, to the people, and they're going to vote them in, and they're going to have less authority.
I agree with you, and it sets up kind of a different branch or another branch of government to the point that appropriates and also make laws, and that seems to be a little bit disconcerting to some people because
what you're going to have is a legislative branch of government and a community branch of government.
Yeah. Final question here as far as marijuana, and you brought that up. Are you running in the city of Vicksburg for every other location, every empty location to be a medical marijuana place?
I have not addressed it at all. What I've been concentrating in the city of Vicksburg is one, getting reelected, and two, making certain that I continue to do the things we're doing and creating a pathway to the future by doing these things without raising anybody's taxes.
Tell me, what were the numbers as far as the election on your race?
Well, we hadn't gotten there. You know, I'm an independent now, and that's because I'm nonpartisan. And
that's right. You weren't on there.
Yeah. But there are two people that are in a runoff, and I look forward to running against either one of them because I think either one of them challenged me to be better.
When is that race? Your race, as far as
there's a runoff on the 27th, but my race will be June the 8th. Starting at 7 o'clock. Yeah, June the 8th. And, of course, you know me. I've never stopped moving. I still do what I do, irregardless. I don't run against people. I don't run negative. I just simply show what I could do if you